Thanks so much for joining us, Dr. Mike Patten here at Blue Waters Health Center. We're here today discussing what most doctors miss about chronic pain. And with that, hit a like, hit a share, subscribe to the YouTube channel, share this with someone you know. We just want to get that word out there about the body is designed to heal itself. So today we're just going to discuss what most doctors, really what most people miss about chronic pain. So to get started, we have to understand the kind of three levels of pain. We have a physical level of pain. Now, physical level of pain is if we roll an ankle or we cut our skin or we do something that causes us to hurt. And this is physical pain. And we need to use physical things with physical pain. The next kind of pain is a mental type pain. This is where if someone violates something you think is right or you think is wrong, that can cause us mental pain. Someone to tell us to get out of a house or something like that, or to tell us that a meal that we made is not very good, that creates a mental pain. And then we have another kind of pain that is more of kind of a spiritual type pain. Say we do an action, we try to help someplace else, we try to help someone out, and it's not well received, or it's out of time or out of sync, then we're going to receive a reaction, and that's going to also invoke a pain for us that maybe we stop doing that action in the future, and then that can cause pain as well. Largely what we see in our country is we see that chronic pain is more of a physical nature and is tried to be covered up with opioids, and it's caused this opioid epidemic in our country and across the world. Because we're trying to use drugs to mask this, and it's not always working. So we have to understand, okay, where does chronic pain come from? And really that gets to the question of how does the body heal? And to understand that, we need to kind of go through how we express health and how we express illness. So what happens is we get in resonance, we get in tune with an idea. So like if I tell you, think about a watermelon, and this watermelon has this, it's got this nice green color. It's got a couple field spots on it when it was laying down. And then if you cut that watermelon in half and open it up, it's got a nice bright red flesh on the inside with a couple seeds in there. Now you can get that picture and you can be in resonance with that picture to such a degree that it starts to produce saliva in your mouth. You maybe even kind of can smell that watermelon flavor when it's really strong and intense like that. So that's us getting in resonance with a picture to such a degree, it produces a physical response. Now we can get in resonance with a picture that we don't like. And we can get in resonance with a picture such as I'm not good enough, or maybe I can't lose weight, or maybe I can never heal. Those are all pictures we can get in resonance and in tune with. And when we take that picture and we apply an emotion to it, such as fear or anger or worry or any of those sorts, those things tend to kind of lock and seal that picture within our subconscious. And once it's down there, it begins to produce itself within our life. And when it produces itself, we start to see physical changes within the body. The first thing that's going to happen is muscle contraction. Muscles always squeeze and contract in response to a stress. And we have a negative picture in that subconscious. Muscles are going to squeeze to protect against it, to try to deflect, get away from that. And as it does that, and the muscles contract, it pulls bones out of alignment and starts to alter nerve flow, alter blood flow. And as this body starts to adapt to this changing environment, now we begin to get symptoms. Now, if that's allowed to run for a long periods of time, it develops into what we call chronic pain. So that acute type pain turns into chronic when it's been there. My general rule of thumb is anything over 6 weeks is developing into a chronic type nature. Now, we could look up a more technical definition of it, but that's not the point of our discussion here today. Our discussion is really about how did it get there? Well, we got there because we got in resonance with an idea. And that's what most doctors, that's what most people miss, is they're in resonance with an idea that got put in their subconscious. Now, there's laws on that mental plane that you can use to change this. You can apply energy to these pictures and change the picture, which will change the outcome. And when you change that outcome, you're going to change the physical expression on the body. The muscle contraction has to begin to release. And when it begins to release, say it's in your neck and you say you have chronic migraine headaches, which is really a muscle contraction at the base of the neck there, and it's producing altered motor and sensory input from the head. We'll release that muscle contraction because we changed the idea that allows those, as those muscles release, that allows for normal blood flow, normal nerve flow, muscles to relax and release. Then the head immediately begins to feel better. If we can change that picture on a permanent basis, that's when healing really comes. Because if the picture's changed, there's no longer the expression on the body. There's no longer that repeated chronic muscle contraction, and that frees us or alleviates us from that discomfort. So if you're someone that has a chronic pain, if you have something that seems to be repetitive and over, or even on a timely basis, just know that we have a picture that's in back of all of it. And in order to heal, we got to change that picture. So what we do at Blue Waters Health Center, we have 6 pictures that we work with. We have perfect glandular health, perfect elimination, perfect digestion, perfect nerve health, perfect muscular health, and perfect circulatory health. Now, those 6 pictures, when we adjust someone, we're adjusting someone to tune that person in, to get them in resonance with one of those pictures. And when that picture gets in there, it's going to demonstrate on their body. And you can palpate along their spine. And when you palpate along their spine, you can ensure that the new picture is taking form, that the person is demonstrating that, because that muscle contraction will release and let go. And then you know that that body is healing and repairing. Now, if we get ourselves in the same environment that created that muscle contraction in the first place, we're going to notice a restoration. I shouldn't even say restoration, but a reappearance of the same symptoms that we had before. So the key is to so alter the environment that you live in that it makes it conducive for health. And that will allow the body to get away from this chronic pain that's really controlling and really destroying someone's life. So the key takeaway is to know what doctors and people are missing is there's a picture in back of the pain. Once we know what the picture is, we can easily change it using the laws involved. If we can't find the picture because of a self-preservation urge isn't allowing us to call it up to our conscious awareness, then what we have to do is we have to take a much broader, bigger picture, follow the laws of the body, mind, and soul, and allow that healing innate power to go through and heal the body from the inside out and just cover up the problem that's there. Either will work. There's 2 different approaches to do it, but the missing piece is always being able to change the picture that's in back of it all. Now, if you're someone that needs some help with that, feel free to reach out to me. I'm Dr. Mike Patten. I'm at Blue Waters Health Center in South Sarasota. You can find me on the web at bluewatershealthcenter.com. If you have any questions, feel free to send in a question, email a question, put a comment below, and let me know what you'd like me to cover next. Thanks so much for watching. Hit a like, hit a share.